Well, welcome everyone. It's great to be with you today. And my name is Finney Curavilla. I'm going to be giving you some updates on COVID-19. This is the data as of yesterday. So you can see here in the United States, which I'm going to be focusing on here, we've had 4 million confirmed cases and about 143,000 deaths thus far. Obviously, there's been a concern, I'm sure you've all seen this in the headlines, that confirmed cases are on the rise in the US. And you can see that cases here, for a while, were going down, but then starting about in the middle of June, they went on a fairly marked uptrend. So how concerning is this and how do we process this? Well, one of the first things that we have to do is situate this in the right context of how many tests have been run. And by the way, all these data I downloaded myself and I manipulated the primary data just in Microsoft Excel to be able to graph it. I encourage you, if you're an Excel person, you can do that yourself. Go to covidtracking.com and you can do the same exercise. So what I did was I downloaded the data looking at test volume. And of course, what you can see here is that test volume has also gone up very dramatically from around 100,000 cases to about, sorry, not cases, 100,000 tests to about 800,000 tests in the time period that's shown. This is the 7-day moving average. And so what you can do is the obvious thing is take the number of positive cases and divide that by the number of tests that are being run to get a more full picture of what's going on in the United States. And here's the answer to that. So this is, like I said, dividing the two here. So it's the percent tests here that are positive. And what you can see is that in late March and early April, there was about 20% of the tests that were run were positive. And as you can see, it's been on a very pronounced decline, going as low as about 4.8% in the middle of June. And then since then, it's had a little bit of an uptick to around 8% since then. So this is very important. And it shows here that it's not quite as bad as you would gather when you look just at this over here, because it's really, like I said, the combination. And what I think this highlights is something that we want to be mindful of with COVID in general. On the one hand, we want to take this disease very seriously, which I think we've tried to do on our presentations in previous calls, and not be denialists. But at the same time, we don't want to be fear mongers or fall prey to an extreme case of paralysis as a result of COVID. And what I think that this graph here does is balances that out. And so, like I said, you can see that we are indeed experiencing an uptick, although maybe not quite as pronounced as you might gather if you were just looking at the media. And in particular, one thing that is the most encouraging is to look at deaths. And if you look here at daily deaths, that has been declining or even stable in the US. And so you can see that we were peaking out at around 2,000 deaths per day, and that's been on the decline. And then you can see a little bit of an uptick to stable. Deaths are a lagging indicator, so it takes a while for the disease to manifest in such a way that someone would have a high degree of mortality and morbidity. But what this says is that, again, the picture is not quite as dire as you might believe if you were just looking at cases in isolation. And one of the themes that I want to highlight in this call is that stocks in the equity market, they appear much more focused on deaths, not on cases. And so here we're looking now at global cases, not at the US. And in orange, rather, you can see that indeed global deaths were on the rise, but then they've declined and been somewhat stable, although a little bit of an uptick, particularly from countries like Brazil and India. And then in green is showing the MSCI World Index, although it's inverted. So you can see here that on the left, the axis is such that the larger numbers are in the bottom. And what you can see here is that the MSCI has been tracking very well with that. And in addition, the MSCI here is advanced 28 days, meaning that it is anticipating the direction that deaths are going to be taking. And so I would say that when you synthesize all of this, we can gain a more balanced picture. And as I said, the equity markets seem to be much more focused on deaths, not on cases, which the media is focused more on cases. In addition to that, incremental improvements are definitely building in medical care with respect to COVID. And this is really exciting, and I don't think this is getting enough attention in the media, so I'm going to spend just 1 minute or so highlighting that. So now we are seeing a definite improvement in standard of care. routinely used now is remdesivir. Remdesivir is the agent that has been in some of the headlines, you probably have seen that, has been shown in randomized clinical studies to decrease hospitalization stays, and there's a very strong suggestion that it decreases mortality as well. I would certainly want this if I were hospitalized for COVID. Dexamethasone has been shown in randomized studies to decrease deaths as well, so that's very exciting. Anticoagulants are now being used routinely. That's also very exciting because we now know that there's a significant component of morbidity from COVID due to patients having blood clots throughout their body. And then this is very interesting. This is called proning. So a treatment that's now becoming fairly standard in the United States is simply to flip patients from being on their back to being on their stomach. So why would this make sense? That's the prone position. So as it turns out, your lungs have more surface area on your back than they do in your front. So in the front, your lungs are constrained in terms of volume because you've got your liver and your stomach and different organs there. And when you lie on your back, you can get fluid that pools in the back of your lungs, particularly if you have an inflamed condition or if you have pneumonia. And that fluid that's now pooling in the back of your lungs is inhibiting your ability to oxygenate properly. So instead, if you flip a patient and put them on their stomach, well, now the fluid's going to collect in your front, where you've got less surface area and where you've got more ability to exchange oxygen, and the back is now able to respire properly. So that's actually very exciting, very simple, basically a free therapy that has significantly improved medical care there. And expected soon are the monoclonal antibodies. I'm not going to be talking about that a lot here on this call, but I am personally very excited about those. These are ways to mimic the ways that we naturally fight off infection in our bodies. And then of course the vaccines, and I am going to be talking about the vaccines, which are extremely exciting. Before we get to the vaccines, I want to just talk a little bit about what we've learned scientifically since the last call. And this article, I think, nicely captures the growing consensus here. And I'm just going to read you a little excerpt from the article that says, "It's not common to contract COVID-19 from a contaminated surface, scientists say, and fleeting encounters with people outdoors are unlikely to spread the coronavirus. Instead, the major culprit is close-up, person-to-person interactions for extended periods. Crowded events, poorly ventilated areas, and places where people are talking loudly or singing, in one famous case, maximize the risk." Okay, this is a really, really important learning, and I hope we can all adapt our behaviors in light of this scientific consensus. Masks. As you know, we've been advocates of masks indoors. I don't necessarily think you need them outdoors. I don't wear them outdoors personally, but indoors I do if I'm going to a store or a place like that. And if you're unclear, here's a simple analogy that maybe has some humor value here. So it's amazing how much controversy there's been around this. It's become very political, although I think less so in the last week. But if we use this analogy here of the urine test, and so imagine that you've got people running around naked and someone pees around you, well, guess what? You're going to get wet right away. However, if you're wearing pants, some pee will get through, but not as much, so you're better protected. But if the person who's peeing is also wearing pants, guess what? The pee stays with him and you don't get wet either, so 2 thumbs up there. So it's a simple analogy, but surprisingly resonant with the underlying science that is the case with masks. There's a lot of people who have promulgated various anti-mask arguments, and I want to do a little bit of fact checking on those now. We've even had some people write into Eventide sharing different articles and perspectives they have had here. So I'm just going to say a little bit on this and invite you to read more if you're interested in this subject. So now we have really great ways of examining these droplets that occur just with basically fancy forms of photography and videography. And so you can see here this individual who's just saying the words, "stay healthy," just speaking normally. And you can see even when you speak just normally, how there are these little droplets that come out of your mouth. Whereas now he's got a paper towel over his mouth and he's saying the same words, "stay healthy," and you can see basically nothing comes out. That's with just a simple, regular old paper towel. The arguments that people are making around masks are saying things like, well, it's like trying to use a chain link fence to keep out a mosquito. And they're, at the same time, they'll say, oh, well, and at the same time, you can't breathe because you've got too much carbon dioxide. Well, hopefully you can see that that argument doesn't hold water because carbon dioxide is a lot smaller than the coronavirus. So you can't have it both ways. You can't say that you're both intaking all this carbon dioxide and it's not effective because the coronavirus is going in and out. In fact, carbon dioxide molecules are about 500 times smaller than the coronavirus, but of course, coronavirus actually travels on droplets, which are even larger still. And so I'm not going to go into a lot of the science here, but I do invite those who want to know more, please do look at the two links at the bottom. One is an article called Particle Sizes for Mass Filtration, and then another article that just goes through now the vast amount of literature that's accumulated here. I really want us as a country to get through this as quickly as possible, and I think this is one of the simple additive steps. It's not the exclusive step that we can take, but it's certainly additive as a precautionary measure to diminish the spread of the virus. Okay, let's talk about biotech and the vaccines. And there's a quote here from Vladimir Lenin who says, "There are decades where nothing happens, and there are weeks where decades happen." I like that quote. It's very illustrative of a number of things that have happened around COVID, particularly around our investment as a country and as the world really into infectious disease. I've highlighted this on previous calls that one of the great themes of our time is this man versus bug theme, that we are fighting off bacteria and viruses that come from all different kinds of locations, mostly from animals, and that we have tremendously underinvested in infrastructure for testing, as well as for therapeutics here. But that's begun to change, and I'm very excited to show you this graph here, which is showing that in the last quarter of 2020, biotech equity funding hit an all-time high. So this is the sum of venture funding, IPOs, and follow-on public offerings. And you can see here, it was $24 billion. And people are realizing what we've been saying for years, which is that we need to be funding more into biotech to support all this great science and to make it a reality so that humanity can flourish in the century. We are very, very excited about this and are participating in these trends ourselves. I want to talk a little bit about the vaccine companies, and I want you to actually remember the names of these companies. You'll be a much more intelligent consumer of the news if you can just remember a little bit here and appreciate some of what's going on. So I'm going to talk to you about 4 companies and the technologies that they're using and the best case approval date. So the first one is a company called AstraZeneca. It's a large pharmaceutical company that is in partnership with Oxford University. Oxford is a very famous university in England, and they have collaborated to use regular technology, which is based on a weakened virus. So the vast majority of vaccines that we consume are based on weakened or attenuated viruses. They've just published their data, which I'm going to show you momentarily here. And they are planning, if all goes well, this is admittedly best case, but to have an approval in September of an emergency use, meaning frontline workers. And then they want to have hundreds of millions of doses, which I'm going to show you, rolled out in the subsequent months. So that's just 2 months away. And this is one of the reasons why the market is rallying, and why people don't get why the market's rallying is because this is happening in the background. So keep this in mind. They're probably in the lead overall, mostly based in England, although trials are being run all over the world. And then secondly, Pfizer, which is an American pharmaceutical company, which is in collaboration with a company called BioNTech, which is a German company. And this is based on a new technology which has never been approved, and it's based on mRNA. So this is just a genetic material. So it's not, there's no virus here. They're just giving basically the genetic material that encodes for viral components. And it's a very, very interesting technology because you can scale it very quickly. You don't have to grow virus. You can just deliver this genetic material. And this is, in a best case approval date, slated to get approved in October, about 3 months from now. Then we have Moderna, which is in our backyard in Cambridge, Massachusetts. And this is based on the same technology, this mRNA, just genetic material only. And best case approval here is probably around December. So we've got 3 viable candidates here that are slated for, admittedly in an optimistic best case, to have approval and to have tremendous capacity, which I'm going to show you momentarily, for production. The last company is called CanSino. This is a Chinese company. This is based on a conventional technology. The early data here, frankly, are not very impressive. And interestingly, it's already approved in China for the military. Not a lot of people are giving this credit for good reasons. I'm not personally very optimistic about this one, but I do want you to know that it's out there because you're going to hear about it in the news. And the Chinese government is pushing this in their populations and hoping that this is going to offer protection there. So these are the 4 leading companies here. And again, I want you to remember them: AstraZeneca, Pfizer and Moderna. And before I show you the data, I want you to just to get comfortable with the term antibody. We hear it a lot. I think of this very simply as a pathogen-seeking missile that's in your blood. So there's one of the components of your immune system is what's called B-cell immunity. And so you have these little B cells here, and basically what they do is they manufacture these missiles. And these missiles are swimming all around your blood, and they're hunting for antibodies, or sorry, they're hunting for antigens like viruses or bacteria. Once these antibodies attach to either the virus here, which is shown as this little star, or a bacteria, which is shown here as this little green capsule, then there's other cells that eat those up. Basically, once they see antibodies that are decorating a bug, then those cells get triggered and they eat them up. What's so powerful about this is that you can easily do a blood test for these missiles, for these antibodies that are in your blood. This is one of the 3 major systems of your immune system, and it's one of the easiest to test. And so this came out just on Monday, so I'm showing you hot off the press data here. This is the results of the phase 1 study from that Oxford AstraZeneca program here. And a lot of people, they see these big acronyms and they get turned away, but don't be turned away. So CH-AD-OX1, CH is chimpanzee, AD is adenovirus, OX is Oxford. So it's this program is based on a virus that infects chimpanzees. It basically gives chimpanzees the cold, and it's a relatively harmless virus, and they've modified that to encode the components of COVID-19, SARS-CoV-2 virus. And here is showing just the amounts in the blood of these antibodies, these missiles, that are directed at components of the coronavirus. And as a control, they used a meningitis virus. And so you can see patients who got that didn't really get a boost in their coronavirus missiles or antibodies. But those who did receive the active virus here, you can see they got a really nice boost in their antibodies. And over on the far right here is comparing that to people who have already had the real coronavirus and looking at how much antibodies those patients had. And so you can see here, we're about in line. The reason that there's 2 panels here is that this is a 2-injection vaccine. So you do a primer and then you do a booster. And so you can see the levels do go up a little bit higher in the boost. I will say that this is going to introduce some logistic challenges to go back twice, right, to go visit the doctor twice. And the virus overall was safe, although you do feel like you get the flu with this. And there's some not surprising side effects that come from this that are considered on target. It's desirable because your body feels like it's getting a virus here, which in this case it is because it's an attenuated virus. Very interesting here, and this has gotten almost 0 media attention. This is the CEO of AstraZeneca. His name is Pascal Soriot. And what he decided to do was to commit company dollars to make the vaccine at scale before approval on the tens of millions of order size so that the vaccine could be distributed quickly. In addition, he said, we're not going to make any profits from this vaccine. So in a world where biotech and pharma is vilified, I think this is really great to see companies stepping up and making these kinds of commitments. Soriot said this: we felt that there are times in life that corporations need to step up and contribute to resolving a big problem like this one. So we decided to do it at no profit. So not only that, but if their vaccine has a hiccup or if it's not approved, they're in the hole for hundreds of millions of dollars that won't get compensated. So this is a really big deal, and I want to highlight this as an example of corporate behavior that we like to see. The mRNA vaccines are also promising. This is from last week. The New England Journal of Medicine released a publication from Moderna. And so very similar as to what I showed before. These are just looking at antibody levels. So higher is better. And so you can see here that you tested 3 different doses, 25 micrograms, 100, and 250. And over time, you can see that they get really nice high levels. And here, interestingly, people are noticing the levels of antibodies are actually higher than patients who've had the disease. So this is really, really interesting. And some people are saying that the mRNA vaccines might even be better than the regular attenuated vaccines because they're getting such powerful responses.